Hello, in this video, I'm going to tell you about what stroke volume is and the different factors that influence the quantity that is stroke volume. So first off, stroke volume is the amount of blood ejected by each ventricle per heartbeat. So we can assess the stroke volume of the right ventricle or the stroke volume of the left ventricle, and it simply means how much blood is ejected in each beat. And from each single ventricle. So the amount of blood that's ejected is regulated by three different factors, and I'm going to discuss each of these individually. So the degree of stretch of the heart, forcefulness of contraction of the cardiac muscle fibers, and the pressure required to eject the blood from the ventricles. So the first two are pretty intuitive. We'll go through those quickly. And the last one with the pressures is a little bit more complex. So I'll discuss that one last. So first is the degree of stretch of the heart. So the heart is made up of elastic tissue, and anything that's elastic means that when we stretch it, once you release the whatever is causing the stretch, that tissue will recoil back to its original shape. So that recoil is applying force that when the heart is stretched, so it's stretched by being filled with blood, when the valves open and that blood is ejected, that recoil is contributing force to the ejection of that blood. So what that means is the more blood that fills the ventricle, the more stretch there is, and therefore the more force that is applied during the recoil once those valves open. So more stretch of the heart is going to equate to a greater amount of stroke volume. The second factor is the forcefulness of contraction. So the cardiac muscle fibers that make up the walls of the ventricle are contracting, just like any muscle in the body. They're contracting, and they can contract with more or less amount of force. Just like you can contract your bicep and produce more or less force depending on what's needed. So the heart does the same thing, although of course it's not voluntary, but we would produce more force with contraction when there's a substance present like epinephrine, for example, also called adrenaline. So when we have epinephrine circulating through the body, one place that acts on is the heart. It will both increase heart rate, but it will also increase the forcefulness of each contraction. So the heart will contract more strongly, essentially, and the more force that is produced by each contraction is going to generate more pressure, and that's going to force more blood out of the ventricles. So that's going to equate to a greater stroke volume. Okay, the final factor is kind of the most difficult to wrap your head around. So the valves, the semilunar valves, we're referring to the pulmonary and aortic valves. So the valves that separate the ventricles from the large vessels into which they're pumping their blood. So those valves open only when the pressure in both ventricles exceeds the pressure into the vessels in which they're pumping. Okay, so it's all based on pressure. Those valves will not open until the pressure in the ventricles is more than the pressure in those vessels. And it has to be both. So those valves open at the same time. So they don't open until the pressure in both ventricles is greater than in both of those vessels. So what that means is that the pressure in the vessels is important in when those valves are going to open. So if we have high blood pressure in those valves, then those valves are going to open later. And actually, I'll talk more about that in detail on the next slide. Okay, so the pressure has to be greater in the ventricles than they are in the vessels, and that is when the valves open. When enough blood leaves the ventricles that the pressure is now less in the ventricles than in the vessels, then those valves close again. Okay, so blood pressure is a really important factor here. So if we have elevated chronic high blood pressure, then what that means is that the semilunar valves are going to open later than normal. Okay, so they're going to open late because it takes more time to accumulate a greater amount of pressure in the ventricles so that it's sufficient to overcome the high blood pressure in the vessels. Okay, so if we have low blood pressure in the vessels, then those valves will open up sooner because we'll be able to achieve the amount of pressure we need earlier. If we have high blood pressure in those vessels, then it's going to take longer to generate a sufficient amount of pressure. So those valves are going to open later because it takes longer to get the pressure high enough to overcome the pressure that's in the valves. It also means that the heart is going to have to contract with a greater amount of force. So remember the second factor, it will have to produce a greater amount of force to produce a greater amount of pressure in the ventricles to overcome the pressure in the vessels. So this happens in two scenarios. We could have high blood pressure in the vessels because of exercise and exertion. So that's in a healthy way. And in that case, we're causing positive, healthy adaptations in the heart, and our ability to achieve a greater pressure and a greater stroke volume to overcome that pressure in the vessels. That's a healthy thing. But if we have high blood pressure in a pathological way, where it's chronic high blood pressure all the time, not due to exertion, then that is bad. It means that the valves are opening later and that the heart is having to work harder all day long without a break. Now, where it comes to stroke volume, what happens is, even if the blood pressure is high and the valves open late, the valves are still going to close at the same time, just about. So as the blood is leaving the heart, the valves are still going to close at the same time. So when the valves open is going to determine how long the valves are open for. So if the valves open early because we have low blood pressure, then they're going to be open for a longer space of time. Then if the valves open later because we have high blood pressure, then the valves are going to be open for a shorter space of time. How long the valves are open will determine the ejection fraction, which is really just meaning of the blood that's in the ventricle, what percentage of it is going to be ejected. And that's the stroke volume, is the amount that's actually ejected. So how long the valves are open will determine what percentage of the blood in the ventricles is going to be ejected. If it's open for a long time, then we'll have a greater ejection fraction, so a higher percentage of blood that's ejected, which is a greater stroke volume. If they're open for a shorter amount of time, then we're going to have a smaller ejection fraction, so a smaller percentage of the blood that's there that will be ejected. So the volume of blood will be ejected. To clarify, ejection fraction is percentages. So of the blood in the ventricle, what percentage is ejected? Stroke volume is about the actual quantity. So like how many milliliters of blood. Okay, so ejection fraction is the percentage, and the stroke volume is an actual measurement, actual amount of blood that is being ejected. Okay, so the later the valves open, the less blood is ejected. The earlier the valves open, the more blood is ejected. So high blood pressure is going to mean lower stroke volume and more work on the heart to be able to produce more force to eject the blood. So as a reminder, cardiac output, so the amount of blood that we are sending out to the body per minute, we calculate that by multiplying stroke volume times heart rate. So if our stroke volume is low because the valves are opening late and we're not ejecting as much blood per beat, if the stroke volume is low, then to achieve the same amount of cardiac output, so if we need to achieve the same amount of blood flow to the body, then our heart rate has to go up to make up for the low stroke volume. Okay, and that's why having chronically high blood pressure will also go hand in hand with chronically high heart rate. And that's because with high blood pressure, we have low stroke volume, and to compensate, we have to have an elevated heart rate to achieve the same amount of cardiac output or blood flow to the body. All right, thank you so much for watching this video, and I hope you have a great day.